Hi, my name is Giovanna Middlebrook, and I was at Florida Hospital of Tampa for my IPPE rotations for Block 3. This is my reflection. So, just to go over a little bit of the preconceived thoughts and expectations I had, I really didn't have any because I've never been exposed to a hospital pharmacy before, just retail. And so, I can say though that I was unsure of the full extent of the pharmacist's role in the hospital because even though I've never been in a hospital for a long time. I have had loved ones stay in the hospital for a couple days, and I've been with them. And I've seen nurses, I've seen doctors, but I've never seen pharmacists come to their bedside. And so I just thought that maybe pharmacists just double check physician orders, especially when it comes to dosing, and help those certain population groups, such as infants, pediatrics, and the elderly. I thought of them maybe as compounding drugs in the pharmacy, such as IV drugs, chemotherapy drugs, and TPN. But like I said, I didn't have much experience. I didn't have much expectations going in, and I just was looking forward to seeing, how a pharmacy is run in a hospital. So although I had a lot of experiences at Florida Hospital of Tampa, one of the experiences that definitely sticks out the most as being more impactful is shadowing Dr. Edwards, and she was a cardiac pharmacist. And although she usually did rounding with patients, she wasn't doing it at the time, unfortunately. But I did watch her, and I observed her going to different floors with cardiac patients, and she helped dose them and give recommendations to physicians. She reviewed lab values to determine appropriate steps in their drug regimen, and she also performed opioid conversion doses. I actually helped her convert a patient that was on morphine to a fentanyl patch, and so that was interesting because I'd never done that in real life. I also observed IV preparation in the IV room, and I did this with Sandra. She was a pharmacy technician, and what I did was I just helped her gather needed supplies, perform calculations. Of course, she was a lot faster than me because she's been doing this for 25 years, and I just observed, how fast-paced it is in the IV room and the need for accuracy that, you need to have. In addition to these two experiences, I was also able to accompany technicians on drug drop-off runs throughout the hospital, observe a surgery, help with stock and inventory, observe the central pharmacy technician, work on an allergy project, and do hospital-based pharmaceutical calculations. And I definitely do think that the course objectives were reinforced throughout my experience at Florida Hospital. So this experience definitely had a big impact on the kind of pharmacist that I want to be when I graduate. I had always leaned towards being a hospital pharmacist as opposed to a retail pharmacist, but I didn't have any exposure to a hospital pharmacy. However, after my IPPE rotations, I can definitely say that I see myself more as a clinical pharmacist than I do as a retail pharmacist. Another thing also that had a big impact was our preceptor. Unfortunately, Dr. Rinker was leaving at the time, but he definitely still influenced our time there, especially mine, because I was able to see, how respected he was as a pharmacy director and how admired he was, not only by his employees, but I think just the community itself. And I definitely think that he got that way not just through hard work, but just because of the person he was. He was very kind, and you could just see that, and the way he acted towards everyone, you know, he was just always warm, and I think that his um, employees respected him and trusted him. And so if I were ever in his shoes, I would definitely want to be the kind of pharmacy director that he was. I definitely had a lot of teachable moments while I was at Florida Hospital, and I learned mostly from the pharmacy technicians because I was mostly paired up with them. And, what they showed me is that they really do form the backbone of a hospital pharmacy. I don't think that pharmacists could do what they do without the help of pharmacy technicians, and they're just very knowledgeable, and they just know, everything that goes into running a pharmacy. And so, some of the strengths of the site I thought was that they follow the course objectives very well, and you could see that in their daily activities. Every time that we went in, we did something different and we learned something new. As far as interacting with others, what it showed me is that, there are pharmacists there, there are pharmacy technicians 3, 2, 1s, people that do stock, the pharmacy director, you know, the office management, and they honestly do form a family. So when you go in, you have to be conscious of that everybody there is family, and you can't, act a certain way with the pharmacy director or with a pharmacist, and then act a certain way, with a pharmacy technician. I definitely think that interacting with everybody, I stayed, humble with everybody. I stayed kind with everybody. And I definitely do think that carries over not just into the workforce, but in people's personal lives. You just have to treat everybody with kindness and respect and not differentiate roles at all. As far as areas of improvement for this site, I really don't have many because I definitely do think that Florida Hospital did a great job with their students. If I had to say anything, is that when we first started, they did give us a sheet of paper that just told us the different days and the different activities that we were going to do on those different days throughout the whole time we were there. And even though they definitely did stick to that schedule for the most part, sometimes they didn't, and so that caused a little bit of confusion between us. When I say us, I mean the other IPPE students that were there. And on one instance, I actually got switched with another activity, and I wasn't able to go to the cath lab, and I was the only one not able to do that. And I was really looking forward to that because all the other students definitely said that that was one of the better experiences. And then another thing is that sometimes when we got there, obviously the pharmacy is very busy, and people that we're going to be paired up with are probably also very busy at the time. And I understand that. The only thing is that sometimes we would sit in the back maybe for like half an hour at a time and not, do anything. And so I definitely do think that that time could have been better spent doing something else and, learning more. And that's honestly all I have to say about, just areas that they can improve on. An activity I wasn't exposed to that I would have enjoyed was pharmacy rounding with the pharmacist. I understand at the time there was a lot of, changes going on, especially with Dr. Anker leaving, but I enjoy talking to patients and counseling patients and just interacting with them overall. And so I definitely do think that that was something that I would have liked to do that I wasn't able to. And then another experience that sticks out is just a negative one, actually, that happened when I went to observe surgery. It was the very first surgery that I had ever observed, and there was a man that was getting operated on, and so, he wasn't conscious anymore, and this was during pre-op, and the surgery team there, it seemed like they all knew each other. They were all, male, and you could tell that, they hung out sometimes probably. And so they were very comfortable with each other, but it was just very surprising because they made derogatory comments about the patient while he was under, especially about his weight because he was overweight. And they said that a couple of times. And I didn't think that was very professional because I know that I've had family members operated on, and I would not like someone to make the comments that they made about anyone that I know or just in general. And then also, while I was there, they were very relaxed and honestly very unprofessional in the kind of topics that they talked about. So that was very surprising. But that's just something that sticks out. Overall, I would rate my IPPE experience an 8 out of 10 because I definitely learned a lot and it was a great experience. It's just that I wish I could have seen more of what pharmacists did. I had no problem being paired up with technicians because, like I said, I definitely learned a lot from them too. But I just would have liked to be more exposed as to, what the pharmacists did, more while I was there. And I didn't have a lot of expectations going into IPPE, like I said, and so I just learned a lot about, just basics and, how a hospital pharmacy is run. I expect to grow in future rotations and practice with more patient exposure and also by being able to interact with more pharmacists. And, it was a great experience overall, and I definitely look forward to my next IPPE experience. Thank you.